Hi, my name is Steve. I'm an antimicrobial stewardship pharmacist and I work in a hospital in Singapore. I decided to embark on a Masters in Clinical Pharmacy to expand my clinical knowledge and to help develop my career. The Masters in Clinical Pharmacy at UCC is very well organised and coordinated, and it works perfectly for when I'm working full-time. I chose UCC as being so far away from home, it was important to me to have excellent online resources with easy access and engagement with the lecturers. The online and IT resources were always easy to use and navigate, and a lecture was never more than an email or a Skype call away. The 2 years are stressful, but well worth it. My favourite part of the Masters were the webinars, which were conducted by consultants and specialist clinical pharmacists. These webinars gave students an opportunity to engage with clinicians and provided a great insight into how they treat and manage real-life clinical situations. The Masters was very valuable to me. It gave me the information and the clinical knowledge I need to ensure I provide holistic care to the patients in my care. It also provided me with the confidence and ensured I was up to date on the latest clinical evidence and best practices. This was particularly helpful and useful, especially when attending ward rounds with the doctors. Beyond clinical knowledge, other skills I learned in this course were presentation and communication skills, as well as statistical analysis and research writing. I would highly recommend undertaking a Masters with UCC for any pharmacists who are seeking to expand their clinical knowledge and their role as a pharmacist.
My name's Regan. I'm a community pharmacist with a hospital background. I undertook an MSc in clinical pharmacy to expand my clinical pharmacy knowledge, and also I needed a challenge. I chose the UCC course because it was a 2-year part-time course and was shorter than many on offer in similar colleges. And it's an online course, and the only time you need to attend the college is for the end of year exams. My thoughts on the course were that it was very well organised. I like the structure of the course. The majority of the course material and associated reading is given to you, so that's great if you're busy with work or family life. There's a large variety of clinical pharmacy topics covered. Many of them are case-based, which makes it interesting and relevant. There are learning options for both community and hospital pharmacists, which is really nice. The webinars, they're given by experts in specific specialities. A lot of the coursework is assessed continuously, which makes it very easy if you're working full-time. It takes a lot of pressure off at the end of the year as well. There were many skills I developed, such as how to retrieve clinical pharmacy knowledge in an efficient and accurate way, which is very helpful when writing reports. I gained a lot of presentation skills. It increased my confidence in public speaking. I got to complete my research project, and this was in a topic that I chose, which was antimicrobial stewardship. The work for my research project was presented as two abstracts at the ECMID conference, which is the European Conference of Clinical Microbiology and Infectious Disease, and also the PRIM conference, which is the Prescribing and Research in Medicines Management in Ireland and the UK. I would highly recommend this course in clinical pharmacy in UCC. It's very interesting, very well run. It's suitable for pharmacists who want to work full-time and study part-time. Thank you for your time. Bye.
Hi there, my name is Marie and I'm a community pharmacist based in Cork City, and in 2019 I completed my MSc in clinical pharmacy with UCC. So why did I choose to study clinical pharmacy? Well, I was about a decade qualified as a pharmacist. I was starting to feel a little bit stagnant in my career, so I felt that undertaking the Masters would help me update my clinical knowledge, number one, and it potentially could open new pathways and areas of interest in my career. The Clinical Pharmacy Masters in UCC was so interesting. I absolutely loved it. The course itself was really well thought out. It was very robust, well-rounded. It covered a broad range of topics and really was very accessible, very manageable, even though I was working full-time as a community pharmacist as well. There were times where it got very stressful. As you can imagine, the workload of a master's is fairly substantial at times, but I have to say the course coordinators and facilitators and mentors in UCC were absolutely fantastic. They gave us so much support during the masters. It was really great. So yeah, that was fantastic. In terms of the skills that I learned from the masters and what I personally got from it, well, I suppose number one benefit is obviously the updating clinical skills and clinical knowledge. Second to none. It was fantastic. Outside of that, I really learned, I got some great experience, say, with online webinars, with giving presentations, with preparing case studies, kind of critical thinking and academic writing skills. They all improved massively thanks to the masters. And the one thing that I really gained from it and that I really enjoyed was the opportunity to develop and undertake my own research project, basically in an area that interested me in terms of community pharmacists and mental health care. And that was a really positive experience for me to be able to write my final thesis in an area that I was quite interested in. And also it facilitated the opportunity for me to present my work to the National Suicide Research Foundation in conjunction with UCC's World Mental Health Day. And that was a very special experience. I really enjoyed it. I loved it. As to recommending the course, I personally found it challenging at times, admittedly, but I very much enjoyed it. I very much loved the support I got from UCC. I loved the modules. It was fantastic the way everything was laid out. I would highly recommend anyone do it. I think particularly community pharmacists can often think that a master's in clinical pharmacy is something that's often geared more towards hospital pharmacists in terms of career progression. But if you have any bit of an inkling, any bit of a thought or anything that you might want to further your education, I would highly recommend to go for it. It was very much enjoyable, and yeah, I would highly recommend it.